So today I'm going to do summary for varicose vein. So a 55-year-old male came with complaints of feeling of heaviness of night cramps, tingling, edema and aching of the lower right extremity accompanied by unsightly appearance of varicose veins on his right legs. So the social data, subjective examination, patient name is Khidir, age 55, sex male. He works as an office worker, previously worked as a factory worker. Patient complains of aching, cramps, large varicose vein. The location of the lower right extremity on the calf area. Radiation, there's no radiation but only on the calf area. Character heavy and throbbing ache. So intensity for the previous year is 3 but recently is now 6. Time of appearance was 15 years ago. So the pain lasts during standing and sitting for too long, around 10 minutes. It increases when there is lack of movement and it decreases when elevating the leg after a leg massage or walking. So the frequency of the pain is usually often during the evening and night. Patient has complaints also of tingling, edema of the leg, hyperpigmentation of the right calf, muscle fatigue of the right leg. So the history of the present disease was that the patient has presence of varicose vein 15 years ago when his job was actually a factory worker. So the size of the vein increases over the years and worsen after changing to his new job. There is a feeling of heaviness and night cramps with varicose vein worsen when he changed to a new job. So patient noticed that he has edema about 5 days ago on his right leg. Patient has no fever and appetite is not affected. Patient did not take any medicine and did massage temporarily to relieve the aching. So patient decided to go to a doctor when he cannot stand the pain and the night cramps become more frequent. So past health history, patient has the past health history no problem except for his family health history. Patient mother and father both had varicose vein. Patient has no diabetes mellitus and no stroke, no myocardial infarction, no deep vein thrombosis and no hypertension. So in conclusion of the subjective examination, patient has no elevated temperature, so there's no signs of infection or sepsis. But the disease is progressing 15 years. So patient is suspected to have second degree chronic venous insufficiency, most likely due to primary varicose vein. And the predisposing factors are hereditary factors, prolonged physical activity on the legs associated with professional activities. So there are also possibilities of deep vein thrombosis and because of the similar clinical picture. So next we move on to objective examination. Patient the general inspection, everything looks normal. Patient condition is satisfactory. GCS is 15. Active posture, face no pathology. Patient height is hyperstenic. His height is 170. His weight is 95 kilogram, and his BMI is 32.9. Uh, during the general inspection is emphasized that we've seen that the patient has edema. So there's no edema of the face, upper extremities or the abdominal region, but there is edema of lower extremity in the right calf. Lymphatic system is normal. Muscular system, pain in the local status. Bones is normal, joints is normal, vertebral column, everything is normal. Head, nose and eyes, nothing interesting. So in conclusion, there's no elevation of body temperature, so there's no signs of intoxication. So we moved on to respiratory system. During inspection, there's form of chest pneumosthenic, respiratory rate is 18, inspection all normal. During palpation, vocal fermentus is normal, elasticity of the chest is normal, position of the trachea is normal. During percussion, comparative and topographic percussion, border of the lung is normal and have clear resonant lung sound on both sides. Auscultation, normal bronchial breathing, and there is weakened vesicular breathing on the right side of the lung without rales, crackles or crepitation. So in conclusion, the respiratory system is not compromised. For GIT examination, inspection is normal, oral cavity no odor, teeth is normal, abdomen, there's abdominal bleeding, but there is abdominal pulsation is absent because the patient is obese. During auscultation, we heard bowel sound. In palpation, uh, surface palpation is without pain, so all those signs, cough sign, Bloomberg sign, Mendel, everything is negative. And the liver is not palpable, spleen is not palpable. And during percussion, the lower border of the stomach is located 2 centimeter above umbilicus. There's no shifting dullness. And during percussion also, the liver size is normal, the spleen size according to Koloff is normal. So in conclusion of the GIT, it is not compromised, but plain chest x-ray can be done as an extra measure. Now we move on to genitourinary system. During inspection, it's normal, no swelling, no hyperemia in the lumbar region, absence of scars. During palpation, the kidney is not palpable and the urinary bladder is not detected. So in percussion, there is normal size of kidney and the Petersky sign is negative. So in conclusion, genitourinary system is not compromised. Next, we move on to cardiovascular system. So in cardiovascular system inspection, there is absence of cardiac humpback, apex beat is visible. There's negative of flash sign, negative jugular venous pulse. There's negative Quincke sign, negative worm sign, and absence of epigastric pulsation, everything normal. During palpation, the apex beat is impulse is normal. It is the location is normal, and cardiac beat not palpable. The aortic arch pulmonary artery is not palpable. There's absence of systolic and perisystolic trails. Heart rate is normal 70 and blood pressure is 145 against 95 millimeter mercury. So during percussion, every right relative, left relative, upper relative, right absolute, left absolute and upper absolute cardiac dullness is in the normal range, normal borders. Transverse heart diameter is normal, vascular bundle is normal. And then during auscultation, every point of the heart, all sounds are normal. There's absent murmurs and no pathological heart sound. So in conclusion of the cardiovascular system, it is not compromised. Next, we move on to the locus status, which is the peripheral vascular system. The peripheral vascular system, the locus status, during inspection, there's no bulging of carotid arteries. There's no pulsation of the abdominal aorta. So the varicose vein on the right calf, there is varicose veins and the right calf, and then there is swelling of the leg as well as hyperpigmentation. The upper extremities are pinkish, but on the lower extremities it is pale and grey. There is small amount of hair is present on the legs, and there's slight brittleness on the toes. So we done the stretch test, it is negative, so we can exclude nervous system. So the blood pressure is measured. Ankle brachial index is for the left and right is normal 0.8. So during palpation of the pulse, everything is present. Pulse is regular and symmetrical in both sides. Temperature is warm on the right leg, right calf of the leg. So but during active movement of the right leg, a patient feel pain on the calf. Capillary refill time is also decreased on the left leg, and cough impulse is present. So during auscultation of all the pulse, we can hear every pulse during auscultation. So the atrial system is not compromised, but the venous system is compromised. So in conclusion of the peripheral vascular system, it is compromised. There's presence of varicose veins, hyperpigmentation of the right calf of the leg, thrombophlebitis of saphenous parvus, there's pain to touch. So according to its classification, it is stage 2 of varicose vein. According to CEAP, it is C4, which is hyperpigmentation, edema and varicose veins, P for primary, S for superficial, and T for thrombosis. So after all the examination is done, the doctor ordered some laboratory investigation, which is APTT, PT, bleeding and clotting time, platelet count, full blood count, urine analysis and stool analysis. And also for instrumental investigation, doctor order duplex scanning, a plain chest x-ray and plethysmography. So that is it for our discussion on the class. This is my summary. Thank you.